Goodbye, Echo. Welcome, Seiko. Six years ago at the Elegant Institute, you talk about the complicated cases, and for last 6 years, whenever I had that kind of trouble situation, I reminded of your saying, we are kind of lonely and try to struggle that kind of moment. But as a surgeon, every day when you face that kind of like stress situation, immediately how do you manage that kind of?
It's difficult. I mean, especially I do a lot of secondary surgeries. So I have patients that have suffered, paid a lot of money, and they put like their last, doctor, you're the last solution for me. I've been traveling around the world. You know, we're not gods.
We're not gods.
And a patient that has had severe surgery and you don't know what previous surgeons did, there's a lot of scar tissue, there's a lot of calcification, and the tissue is all destroyed, or they had some products injected into their breast that totally destroys the breast. I mean, I've had patients coming to me where I open up the breast and I see the heart. I see the heart in front of me, and I go like, what's going on here? Because they had products injected into the breast that's migrating, destroying the tissue, destroying the muscles between the ribs. When you have those situations, of course, you know, it's like a cold thing grabbing your heart, because I'm supposed to solve this. It's not easy.
It's not easy.
And everyone in the room freezes like, what's going on here? So that's where you just need to breathe in and out, and okay, I can do this. I'm well trained. We have this experience, and I try to deal with it as good as possible. The difficult thing really that I find is the discussion with the patient. When things don't go exactly the way you want, where you have to say, listen, I couldn't solve this. I had to close this up, and we'll have to do this in 2 stages. You'll have to come back in 3-6 months, and then we'll do the next surgery, and I'll put all my energy, all my love, all my experience into solving this. But I could not do this in one session because the tissue was too inflamed, it was too bad, it was too scarred. That discussion you have to have with the patient afterwards, but also before, telling them, listen, this might occur, but giving them hope. We can solve this. How do I get that energy? Well, I'm comfortable with myself and who I am, and I know I will always do everything I can. I will put everything that I have into solving this problem. It's about finding that trust with the patients and having the energy from your surrounding to take on yourself those difficult tasks.
I feel the same. I try to be like honest with the patient, and sometimes like tertiary or people who have gone through like more than 4 times of surgery, they don't trust the doctors at first. So we have to make a like emotional and kind of relationship to solve the problem. So sometimes I feel like that kind of situation in the operation room. So
but that's what we're trained for. I mean, it's like in a battle, you know, as a soldier. And that's why we're leaders in our field to take that responsibility. And that's what the patients expect from us. And we should expect from ourselves.
Well, that gives a lot of help to me. A lot of people are kind of like very curious and worried about their surgery if they have a surgery plan. I think that mentioned, can you give a little bit more explanation about that?
First of all, if there's an advice I can give anyone watching this, if you want to have breast surgery, go to a board certified plastic surgeon. That's well trained. Why is that important? Because you want to go to someone that can give you a guarantee of your results. So anything can go wrong. And how do you take care of someone? Well, it's not just taking care of the problem. More important is taking care of not causing a problem. And how do you do that? Well, like you saw the slide from Peter Drucker, if you don't measure, you don't know what to manage. So taking care is really following your patients over time. So although they don't have any problems, you take them back. 6 months, 2 years, 4 years, 6 years, you take them back and you check them with ultrasound. You see everything is okay. You tell them, looks beautiful. This is perfect. Now you can sleep well. Don't worry. I'll see you in 2 years again. Then you do the same thing. So collecting data, taking care of those patients is the best way to prevent complications. And that's why I tell surgeons, you need to follow your patients because you do surgery maybe slightly different than I do. And on patients that are different than my patients. My patients are Caucasian mainly. Yours are Asian. the breast is different. So if you collect your own data, you will know in your environment, in your world, what is best for your patient. And that is taking care of your clients, your patients. And that's what I want all surgeons to do.
Yeah, I think from my experience, I try to collect data every time when the patient comes for the follow-up. And after that, I also do refinement of my surgery skills. And sometimes feel frustrated.
We all do.
Yeah, overwhelmed. I think numbers talks.
And when they come back after 6 months to 2 years, and they express their happiness, their joy, we grow.
Yeah.
I mean, because when we do surgery, we give so much of our energy, and we get that energy back through their happiness. So, I mean, that is our role. We truly do give our patients quality of life.
Yeah, I think so too.
And this heart, and this heart, and all the hearts.